Hello everyone, I am Dr. Swapnil Pathak from the Department of Cardiology at Midland Hospital, and today I am going to discuss with you the effect of sleep disorders on the cardiovascular disease. Sleep disorders are basically classified as the obstructive sleep apnea and the central sleep apnea, and sleep, as we all know, is a state of cardiovascular relaxation. When you sleep, your heart rate, your blood pressure, your sympathetic activity goes down during the non-REM phase of the sleep, which accounts for around 85% of your total sleep time. Whereas in the REM state of sleep, your heart rate and blood pressure rises, but the REM phase only lasts for 15% of your total sleep time. So overall, if we see in our sleep duration, our heart is in a state of relaxation with decrease in the blood pressure and the heart rate. Anything which interferes with sleep is going to interfere this cardiovascular relaxation. Different studies and multiple trials have shown that the sleep disorders are related to myriad of cardiovascular disease like hypertension, diabetes, coronary artery disease, cerebrovascular accidents and heart failure. If we look at the numbers, that around 50% of the patients with diabetes suffer from sleep apnea. Around 30 to 40% of hypertensive patients suffer from sleep apnea. And what is also important to note is that around 80% of patients who have got resistant hypertension, that is, the hypertension is not controlled by 3 or more drugs, including a diuretic, in them around 80% of them have sleep apnea. Also, the coronary artery disease, the prevalence, the risk and the mortality increases in patients who have got sleep apnea. So in nutshell, what we can conclude is that sleep disorders is a very important risk factor for cardiovascular disease, both causing its incidence, prevalence and mortality due to it. Proper diagnosis and proper treatment of sleep disorders is very important for prevention of cardiovascular diseases. The gold standard technique for diagnosing sleep disorders is polysomnography or nocturnal sleep study, and if it is properly diagnosed at a proper time and intervened with proper treatment protocols, then we can always save the patient from the development of cardiovascular disease, or if he or she has, then the disease can be better controlled by our usual medicines. Thank you so much.